Welcome back. I'm now joined with Dr. Troy Kimsey, surgical oncologist at Phoebe. Welcome, Dr. Kimsey.
Thank you for having me.
Dr. Kimsey, today we're talking all about cancer awareness. And from your perspective, I want you to kind of start off by telling us why these breast screenings are so important.
Yeah, well, I think from a clinical standpoint, we know that although we've made tremendous advances in treatment and from surgery to radiation to different chemotherapies, we still know that by far our best outcomes are from early detection and detecting cancer at an earlier stage. So really screening is that modality. So if we can screen women for breast cancer and catch it at a very early stage, then we know that outcomes are much better. So if we aren't able to detect it until we can feel it or they're having symptoms, then we know that in a lot of ways we're already behind a little bit when we start treatment.
And I know as the years have progressed, you've seen advancements in things like genetic testing. Talk to me a little bit about that.
Yeah, so we know the prevalence of breast cancer, for example. So 1 in 8 women will develop breast cancer in their lifetime. But there are certain women in our population and men as well who are at significantly increased risk of breast cancer just based on genetics. And so for that reason, we've developed a very comprehensive genetic screening process where every one of the people that come into one of our breast centers to get their screening mammogram undergoes a questionnaire that talks about family history and other risk factors and kind of qualifies to see if they meet the standards to get genetic testing. And if they're positive, that can significantly increase their risk of breast cancer over a lifetime, and it really changes how we approach that patient, recommendations we make from different screening modalities, more frequent screening, even up to consideration of what we call prophylactic mastectomies, where we talk about removing the breast to reduce their risk of cancer. There's some genetic mutations that carry up to an 80% lifetime risk of breast cancer. And so we want to be able to identify those patients so that we can help them navigate those decisions properly.
And it's a simple blood test. It's with the genetic testing, it's not very hard to have that done?
Correct. Yes. And so it's, it usually starts with a questionnaire, and then you kind of try to see what someone's risks are. If they're identified as somebody that has an increased risk, then they go through that process of blood testing and then follow up if they happen to have a mutation that puts them at increased risk. And the neat thing that's going on in the breast center is that if they do have mutations, they're not just specific to breast cancer. So it can involve other types of cancer, and it allows us to identify those risks as well, and then they'll get a referral to medical oncology where they're involved in a high-risk clinic, and that really guides how we recommend screening of all types of cancer.
Would this also be somewhat of a layer of early detection for their siblings or family members as well?
Absolutely. So knowing that family history and then knowing genetic risks allows us to identify other family members who are also at risk and can, enter that same process where they talk about different levels of screening, different screening modalities. In women with high risk, we'll usually alternate the mammogram with a breast MRI. So it allows us to make those recommendations based on their life.
Now I want to move a little bit and let's talk about the multidisciplinary tumor board. I believe it's what it's noted as, that where the providers get together and kind of customize a plan of care. Let's talk about that.
Yeah, at Phoebe, we feel like that's critical to a patient's treatment journey. So there's going to be multiple different providers involved. And so typically that involves surgery to some degree, medical oncologists who do chemotherapy and immunotherapy, and then the radiation oncologists that do radiation. So typically when we're looking at how to care for these patients, there's multiple providers involved. And so we feel like these conferences are essential in terms of everyone getting on the same page and really developing a consensus recommendation for that patient's treatment journey. And that can include clinical trials, it can include the order of things that we recommend. So sometimes we recommend surgery first, sometimes we feel like it's beneficial to do chemotherapy first. And so, it allows us to sit down at the table and everybody be together. And what I talk to my patients about on a regular basis is, a lot of times we'll send or get a second opinion about treatment. And this is really kind of 15 opinions at one time that allows us to kind of look at all the details of pathology, their imaging, and decide what's the best treatment course before we start treatment.
Okay, this is such great information. We're going to take a quick break. Stay tuned and we'll be right back.